Good afternoon, everyone. Bonjour tout le monde. Apologies for the delay. Nos excuses pour le délai.
We apologize for the delay.
Welcome to this technical briefing on the AstraZeneca COVID-19 vaccine. We have with us today Dr. Supriya Sharma and Marc Berthiaume from Health Canada, Dr. Shelley Deeks and Caroline Quash from the National Advisory Committee on Immunization, and Dr. Howard Njoo on behalf of the Council of Chief Medical Officer of Health. Avec nous aujourd'hui, les docteurs Supriya Sharma et Marc Berthiaume de Santé Canada,
are Dr. Sharma and Berthiaume from Health Canada, Dr. Caroline
du Conseil
Quash
consultatif national de l'immunisation,
from the National
ainsi que le
Advisory
Dr.
Council
Howard
on
Njoo au nom
Immunization,
du
as
Conseil
well
des
as
médecins
Dr.
hygiénistes en
Njoo.
chef. We'll start with Dr. Sharma from Health Canada. Dr. Sharma, à vous la parole.
Thank you. Merci. Bonjour. Good day, everyone. Thank you for joining us. As part of Health Canada's continuing commitment to openness and transparency, the department is updating Canadians on new actions related to the AstraZeneca vaccine. Health Canada has previously communicated on its ongoing assessment of very rare adverse events reported in Europe of blood clots with low platelets occurring after immunization with the AstraZeneca vaccine. The product information was recently updated to reflect this information. To date, no cases of these events have been reported in Canada. However, through our ongoing international collaboration, Health Canada has become aware that additional cases of these events have been reported in Europe. In light of this evolving information, Health Canada will be issuing additional terms and conditions on the authorizations of the AstraZeneca and Verity Pharmaceuticals Serum Institute of India vaccine. These will include a requirement that the manufacturers conduct a detailed assessment of the benefits and risks of the vaccine by age and sex in the Canadian context. This information will support the ongoing evaluation of these rare blood clotting events and allow Health Canada to determine if there are specific groups of people who may be at higher risk. Health Canada will assess this information when it's received and will determine if additional regulatory actions are necessary. We will continue to work collaboratively with international counterparts to collect and assess this information. Health Canada's guidance issued to healthcare practitioners last week still stands and provides vaccine recipients with information on the signs and symptoms to monitor following vaccination. Thank you.
Bonjour à tous, je vous remercie de votre présence.
Hello, everyone.
Dans le cadre de son
Thank you for
engagement
tuning in
continu
today.
à communiquer de
As
manière
part of Health
transparente,
Canada's continuing
Santé Canada
commitment to
informe les
openness
Canadiens
and
et les Canadiennes
transparency,
de nouvelles
Health
mesures qu'il a
Canada
prises liées
is
au
now
vaccin
informing
d'AstraZeneca.
Canadians of new
Santé
actions
Canada
it has
a déjà
taken
publié une
as
déclaration
relates
sur
to
son
the
évaluation
AstraZeneca
continue
vaccine.
d'événements
Health
indésirables
Canada
très
has
rares
previously
signalés en Europe,
communicated about
à
its
savoir des
ongoing
cas de
assessment
caillots
of very
sanguins
rare adverse
associés à un
events
faible
reported in
nombre de
Europe
plaquettes
of
sanguines
thrombosis,
après
blood
l'administration
clots,
du vaccin
with low
d'AstraZeneca.
blood platelets
Les
occurring
renseignements
after
sur le produit
immunization with the
ont récemment
AstraZeneca
été mis à
vaccine.
jour
The product
pour inclure
information
cette
was recently
information.
updated to reflect this
Jusqu'à présent,
information.
aucun cas de
To
ces
date,
événements n'a été
no
déclaré au
cases of
Canada.
these events have been reported
Cela
in
dit,
Canada.
grâce à notre collaboration
However,
internationale
through
soutenue,
our
Santé Canada
ongoing
a appris que
international
d'autres cas avaient
collaboration,
été déclarés
Health
en
Canada
Europe.
has become
À la
aware that
lumière de ces
additional cases
renseignements
of
qui
these events
évoluent,
have been
Santé
reported in
Canada
Europe.
soumettra à
In
d'autres
light of this
conditions
evolving
les
information, Health
homologations des
Canada will
vaccins
be issuing
d'AstraZeneca
additional terms
et
and
de
conditions
Verity
on the
Pharmaceuticals
authorizations
Serum
of the
Institute of India.
AstraZeneca and
Il
Verity
faudra, entre
Pharmaceuticals
autres, que les
Serum
fabricants
Institute of
effectuent
India
une
vaccines.
évaluation approfondie des
These
avantages et
requirements
des risques
will
du vaccin
include a
selon
requirement
l'âge
that the
et le sexe dans le
manufacturers conduct
contexte
a
canadien.
detailed assessment of the
Ces
benefits and
renseignements
risks of the vaccine
faciliteront
by age
l'évaluation
and sex
continue
in
de
the
ces
Canadian
rares cas
context.
de caillots
This
sanguins
information
et
will support
permettront
the
à
ongoing
Santé Canada de
evaluation of these rare
déterminer
blood clotting
si des groupes
events,
particuliers peuvent
in
être
addition
plus
to allowing Health
susceptibles à ce
Canada to
problème.
determine if there are specific
Santé
groups of
Canada
people who may
a eu des
be at higher
discussions
risk.
à propos
Health Canada
à ce
has been
sujet
in
en
talks with
constante évolution
AstraZeneca
avec
on
AstraZeneca.
this evolving
Le
issue.
ministère
Health
évaluera les
Canada
renseignements
will
dès qu'il
assess
les
this
recevra
information when it
afin de
is received
déterminer si
and
d'autres
will
mesures
determine if
réglementaires
additional
s'avèrent
regulatory
nécessaires.
actions will be
Santé
necessary.
Canada continuera de
Health Canada will
collaborer
continue
avec ses
to work
homologues
collaboratively
internationaux
with
pour
its
recueillir
international
et évaluer
counterparts to
l'information.
collect and assess
Les
information.
directives transmises par
Health
Santé
Canada's
Canada aux
guidance
professionnels de
issued
la
to
santé la
healthcare
semaine
practitioners
dernière
last week
restent en
still
vigueur
stands
et informent
and
les
provides
personnes qui se
vaccine
font
recipients
vacciner
with
des
information
signes et des
on the
symptômes
signs
à
and
surveiller
symptoms to monitor
après la
for following
vaccination.
vaccination.
Merci.
Thank you.
Est-ce qu'on peut poursuivre? Can we...
Shelley, could you please turn on your microphone?
My apologies, everybody. Okay, so the National Advisory Committee on Immunization, or NACI, is recommending that AstraZeneca COVID-19 vaccine should not be used in adults under 55 years of age at this time, while the safety signal of vaccine-induced prothrombotic immune thrombocytopenia, or VIPIT, following vaccination of AstraZeneca COVID-19 vaccine is investigated further. As you've heard, rare cases of serious blood clots, which have been associated with low platelets, have been recently reported in Europe following the use of AstraZeneca vaccine in that population. Cases identified so far have primarily been in women under the age of 55, although cases in men have also been reported. These events have mostly occurred between 4 and 16 days after receipt of the vaccine. This adverse event is being called VIPIT. The exact mechanism by which the AstraZeneca vaccine triggers VIPIT is still under investigation, and no other risk factors have been consistently identified in patients who develop VIPIT. This adverse event has not been identified following either mRNA COVID vaccine to date. Right now, we do not know with certainty the rate of this adverse event. Based on information from the European regulator last week on March 18th, it was originally estimated to occur at approximately 1 per million vaccinated with AstraZeneca vaccine. However, a higher rate of 1 per 100,000 has been reported by the Paul-Ehrlich Institute in Germany. Based on available information, the case fatality of this condition is approximately 40%. However, this may decrease with increased awareness of VIPIT and appropriate early treatment. Following a population-based analysis, considering what we know of VIPIT, assessing the risk of COVID-19 disease in Canada by age, and considering that alternate vaccines are available in Canada, NACI has determined that there is substantial uncertainty about the benefit of providing AstraZeneca COVID-19 vaccine to adults under 55 years of age, given the potential risks associated with VIPIT. As a precautionary measure, while Health Canada carries out an updated benefit risk analysis based on emerging data, NACI recommends that the vaccine not be used in adults under the age of 55 years. Adults 55 years of age and older may still be offered the AstraZeneca vaccine with informed consent, given that the increased risk of severe COVID-19 disease in this population, and as VIPIT appears to be rarer in that age group. I'm now going to turn it to Dr. Quash-Chan.
Bonjour et merci. Donc, le Comité consultatif national de l'immunisation, ou CCNI, recommande que le vaccin AstraZeneca contre la COVID-19 ne soit pas utilisé chez les adultes de moins de 55 ans à ce moment. Pendant que le signal de sécurité de la thrombocytopénie immunitaire prothrombotique induite par le vaccin, que nous appellerons TPIV pour les intimes, survenant après l'administration du vaccin AstraZeneca contre la COVID-19, soit davantage étudié. Comme vous le savez, de rares cas et de graves cas de caillots sanguins associés avec un décompte plaquettaire faible ont été récemment rapportés en Europe suite à l'utilisation post-homologation du vaccin d'AstraZeneca. Les cas identifiés jusqu'à présent concernaient principalement des femmes de moins de 55 ans, bien que des cas chez des hommes aient également été signalés. Ces événements sont pour la plupart survenus 4 à 16 jours après la réception du vaccin. Cet événement indésirable est appelé TPIV, comme nous l'avons dit précédemment, et est associé au développement d'anticorps qui activent les plaquettes, stimulant ainsi la formation de caillots suivis d'une thrombocytopénie. Le mécanisme d'action est similaire à celui de la thrombocytopénie induite par l'héparine et le mécanisme exact par lequel le vaccin AstraZeneca déclenche ce TPIV est toujours à l'étude. À l'heure actuelle, aucun autre facteur de risque n'a été systématiquement identifié chez les patients qui développaient une TPIV. Et à ce jour, cet événement indésirable n'a pas été identifié à la suite de la réception des vaccins à ARN messager contre la COVID-19. Le taux de cet événement indésirable reste à confirmer. Sur la base des informations issues de l'Agence européenne des médicaments le 18 mars dernier, il a été initialement estimé à environ 1 cas pour 1 million avec le vaccin AstraZeneca, mais un taux plus élevé de 1 pour 100 000 a été rapporté par l'Institut Paul Ehrlich en Allemagne. Des informations complémentaires sont actuellement recueillies afin de caractériser plus précisément le taux. Et sur la base des informations disponibles, la létalité des cas de type IV est d'environ 40 %. Cependant, cette létalité pourra diminuer avec une sensibilisation accrue à l'événement indésirable et un traitement précoce approprié. Suite à une analyse populationnelle des bénéfices et des risques de la type IV, basée sur l'information disponible, comparée aux risques de maladie de COVID-19 selon l'âge et compte tenu des approvisionnements prévus de produits de remplacement disponibles au Canada, d'après ce que l'on en sait à l'heure actuelle, il existe une incertitude substantielle sur les bénéfices de l'administration du vaccin AstraZeneca contre la COVID-19 pour les adultes de moins de 55 ans, compte tenu des risques potentiels associés à la type IV, en particulier aux taux estimés les plus bas. Par mesure de précaution, pendant que Santé Canada effectue une analyse actualisée des avantages et des risques en fonction des nouvelles données, le CCNI recommande donc que le vaccin ne soit pas offert aux adultes de moins de 55 ans. Avec un consentement éclairé, le vaccin d'AstraZeneca pourra être proposé aux adultes de 55 ans et plus, étant donné que le risque d'hospitalisation et de décès associé à la COVID-19 est plus grand dans cette population et que la type IV semble être un événement plus rare dans ce groupe d'âge. Merci. Je passe maintenant la parole à Dr. Howard Njoo.
Merci beaucoup. Thank you very much for having me today on behalf of the Council of Chief Medical Officers of Health. As you know, the federal government has a responsibility for the regulatory approval and the procurement of vaccines, while provinces and territories are responsible for the immunization of their populations. As Canada's Chief Medical Officers of Health, we take vaccine safety very seriously. In Canada, there are mechanisms to investigate and share reports of serious adverse events following COVID-19 vaccination to determine if they are causally linked to COVID-19 vaccines. On March 24th, 2021, Health Canada issued a label change and guidance on the AstraZeneca COVID-19 vaccine, following European reports of rare but serious cases of blood clots associated with low levels of blood platelets, i.e. thrombocytopenia, following immunization with the AstraZeneca vaccine. Health Canada will be issuing additional terms and conditions requiring AstraZeneca manufacturers to conduct a detailed assessment of the benefits and risks of the vaccine by age and gender in the Canadian context. This information, along with further international evidence, will be used to determine if additional regulatory actions are necessary. In the interim, Canada's National Advisory Committee on Immunization, or NACI, is recommending an immediate pause in the use of the AstraZeneca vaccine in all individuals less than 55 years of age in Canada. This is based on the evidence of rare instances of vaccine-induced prothrombotic immune thrombocytopenia, or VIPIT, following AstraZeneca vaccination reported in Europe, with associated high case fatality and related serious outcomes. As Chief Medical Officers of Health, we are acting decisively with our unified position to pause the use of AstraZeneca vaccine in Canada in those under age 55 at this time. We are taking this precautionary measure while Health Canada, as the regulator, completes its updated risk-benefit analysis based on emerging data. During this time of risk assessment, Canada has other vaccine options to address the ongoing risk of COVID-19 infection. To date, such adverse events have not been reported in Canada, and AstraZeneca vaccine has not yet been used in large numbers in Canada. Following population-based analyses of VIPIT, assessing the risk of COVID-19 by age, and considering availability of other vaccines, such as the mRNA vaccines, from what is known at this time, there is substantial uncertainty about the benefit of providing AstraZeneca vaccine to adults under 55 years of age, given the potential risks associated with VIPIT. At this time, we are pausing the use of AstraZeneca vaccine to adults under 55 years of age, pending further risk-benefit analysis. Adults 55 years of age and older may still be offered the AstraZeneca vaccine given the increased risk of hospitalization and death due to COVID-19 in this population, and since VIPIT reports have been even rarer in that age group. While these reported adverse events have occurred primarily in women, investigations are ongoing as it is possible that more women receive the AstraZeneca vaccine, making it difficult to assess risk based on sex. The outcome of VIPIT can be serious, including death. If diagnosed early, VIPIT can be treated and the risk of serious outcomes reduced. Based on current evidence, for those individuals who have already been vaccinated with AstraZeneca for more than 20 days, there is no cause for concern. For those who have been vaccinated with AstraZeneca for less than 20 days, and anyone vaccinated with the AstraZeneca vaccine going forward, you should seek immediate medical attention in the rare event that you develop symptoms starting 4 days or more after vaccination, such as shortness of breath, chest pain, leg swelling, persistent abdominal pain, sudden onset of severe or persistent worsening headaches or blurred vision, and skin bruising, other than at the site of vaccination. Decisions on the type of second dose that will be offered to those who have been vaccinated with the AstraZeneca vaccine will be determined based on the latest evidence and research. NACI will review evidence as it emerges to provide advice to public health programs on the potential for completing the vaccine series with other vaccine products. For now, you do not need a second dose for up to 16 weeks from your first dose. This decision is part of the vaccine safety monitoring and response approach that has long been established in Canada and used to monitor all vaccines, including COVID-19 vaccines. We are responding to the safety signal with the information we have at this time, and we will be reviewing new information to inform any changes in our position in the days ahead. Chief Medical Officers of Health are aligned and working closely together to review and act on the latest evidence on safety and effectiveness of COVID-19 vaccines. We will continue to work together to adapt our approaches as the science and situation evolves and provide clear and evidence-informed guidance in order to keep everyone in Canada safe and healthy. Thank you. Merci de m'accueillir aujourd'hui au nom du Conseil des médecins hygiénistes en chef. Comme vous le savez, le gouvernement fédéral a la responsabilité de l'approbation réglementaire et de l'achat des vaccins, alors que les provinces et les territoires sont responsables de l'immunisation de leur population. En tant que médecins hygiénistes en chef du Canada, nous prenons l'innocuité des vaccins très au sérieux. Au Canada, il existe des mécanismes pour enquêter et communiquer les rapports sur les effets indésirables graves suivant la vaccination contre le COVID-19 pour déterminer s'il existe un lien de causalité avec les vaccins contre le COVID-19. Le 24 mars 2021, Santé Canada a publié une nouvelle version de l'étiquette ainsi que des directives sur le vaccin contre le COVID-19 d'AstraZeneca à la suite de la publication de rapports européens portant sur des cas rares mais graves de caillots sanguins associés à des faibles taux de plaquettes sanguines, c'est-à-dire thrombocytopenie, à la suite de l'immunisation au moyen du vaccin d'AstraZeneca. Santé Canada publiera également des conditions selon lesquelles les fabricants d'AstraZeneca doivent procéder à une évaluation détaillée des avantages et des risques du vaccin selon l'âge et le sexe dans le contexte canadien. Ces renseignements, en plus d'autres données probantes internationales, seront utilisés afin de déterminer si des mesures réglementaires supplémentaires sont nécessaires. Entre-temps, le Comité consultatif national de l'immunisation, ou CCNI, recommande une pause immédiate dans l'utilisation du vaccin d'AstraZeneca chez toutes les personnes âgées de moins de 55 ans au Canada. Cette recommandation est fondée sur des cas rares de thrombocytopénie immunitaire prothrombotique induite par le vaccin ou typique après la vaccination moyenne de vaccin d'AstraZeneca signalé en Europe avec un taux élevé de létalité et des séquelles
with
sérieuse.
associated high
En
case
tant que médecin
fatality and
hygiéniste en chef,
associated
nous
outcomes.
agissons de manière
As Chief
décisive
Medical
dans notre
Officers of
position
Health,
unifiée
we are
en vue de
taking
prendre une pause de l'utilisation du vaccin
action
d'AstraZeneca au
swiftly,
Canada
and we are
chez les personnes
united
âgées
in
de
our
moins de
recommendation to
55 ans
pause use
pour le
of the
moment.
AstraZeneca vaccine
Nous
in
adoptons
Canadians
cette
under
mesure de
55 for the
précaution
time
pendant
being.
que Santé
We are
Canada,
taking
en
this
tant
precautionary
qu'organisme de
measure while
réglementation,
Health Canada,
termine
as
son
the
évaluation
regulator,
complète des
completes
risques
its
ainsi que pendant
risk-benefit
nous recueillons
analysis.
de plus amples renseignements
We
et
will also be
analyses auprès
collecting
de
more
nos
data
partenaires internationaux.
and
Pendant cette
analyzing
période
it with
d'évaluation des
our
risques, le
international
Canada a
counterparts.
d'autres options de
During
vaccins
this
pour contrer le risque
risk-benefit
continu
assessment,
d'infection
Canada
à la
has other
COVID-19.
mechanisms
À ce jour,
to monitor
aucun
and
effet
track
indésirable
vaccine
n'a été
safety.
signalé au
To
Canada
date,
et le vaccin
no such
d'AstraZeneca n'a
adverse
pas été
events have been
administré
reported
en
in
grand
Canada.
nombre au Canada.
Moreover, the
Suivant une
AstraZeneca
analyse de la
vaccine has
TPIF
not been
basée
widely used in Canada.
des populations d'une évaluation des risques associés à la COVID-19
Based on
en
our
fonction de l'âge,
assessment,
après avoir examiné
based
la
on, for example,
disponibilité
age
d'autres
groups,
vaccins,
and
c'est-à-dire les
given the
vaccins
availability
à
of other vaccines,
l'ARN,
that is
et en
mRNA
fonction de ce
vaccines,
que nous savons en ce moment,
and
il
given
existe une incertitude
currently existing
substantielle
science,
concernant l'avantage d'offrir le
we
vaccin
are
d'AstraZeneca
certain
aux adultes
that there
âgés de
is
moins de 55 ans,
we are
étant
not
donné les
entirely
risques
certain, in
associés à la
fact,
TPIF.
about the benefits of giving the
En ce
AstraZeneca
moment,
vaccine to
nous
adults under
prenons une
55
pause sur
due to the risk
l'utilisation du
of
vaccin
VIPIT.
d'AstraZeneca
At this
chez les
time, we
adultes de
are
moins de
pausing
55
use
ans
of the
en
AstraZeneca
attente d'une
vaccine
analyse des risques et
in
bénéfices.
adults under
On peut
55,
toujours offrir le
pending
vaccin
further
d'AstraZeneca
risk-benefit
aux
analysis.
adultes âgés de
It is still
55 ans et
possible
plus, compte
to
tenu du
have
risque
this
accru
vaccine for adults over
d'hospitalisation et
55
de
years of
décès liés
age,
à la COVID-19
given
dans
that this
cette
age group
population,
has an
et puisque
increased
les
risk of
rapports de
hospitalization
TPIF
and
sont
death from
encore plus rares dans
COVID-19.
ce groupe d'âge.
Furthermore,
Bien
reports
que
of
ces
VIPIT
effets
cases are even
indésirables
lower in
aient
the
été
over 55
signalés
age group.
principalement chez les femmes, les
The
enquêtes sont en cours
majority
car il est
of VIPIT
possible qu'un
cases
plus
have
grand
been in
nombre de
women,
femmes
but the study
aient
is
reçu le
ongoing
vaccin
because it's
d'AstraZeneca,
possible that simply
compliquant
more
ainsi
women were
l'évaluation des
vaccinated with
risques
the
fondés sur
AstraZeneca
le sexe.
vaccine.
Le
So
résultat
more
de
study
TPIF
is
peut être
necessary
grave,
to
y
determine
compris la mort.
sex-related or
Si
gender-related risks.
diagnostiqué tôt, TPIF peut être
Outcome of
traité et le risque de
The outcome
séquelles
of
graves
VIPIT can
réduit.
be very serious,
Selon
including
les données
death.
probantes
But if
actuelles,
VIPIT is
en ce qui
diagnosed early,
concerne les
it can
personnes
be
ayant
treated.
déjà reçu le vaccin
Based on
d'AstraZeneca,
evidence,
il y a plus de 20
individuals
jours,
who have been
il n'y a pas
vaccinated
lieu
with
de s'inquiéter.
AstraZeneca for over 20
Quant aux
days,
personnes
there's
qui ont reçu
absolutely
le
no
vaccin
cause for concern.
d'AstraZeneca il y a moins de
For
20
those
jours,
who received the
vous devriez
AstraZeneca
consulter
vaccine
immédiatement
in the
un
past
médecin
20
dont
days, or who
l'éventualité
will
rare
receive this
où
vaccine
vous
going forward,
développeriez
please
des
seek medical
symptômes débutants
attention in the
4
case of
jours
the
après
following
votre
symptoms,
vaccination.
which may
Par
begin
exemple,
4 days
essoufflement,
after
douleur
vaccination.
à la
Symptoms
poitrine,
include
enflure des
shortness
jambes,
of breath,
douleur
chest pain,
abdominale
leg swelling,
persistante,
persistent
apparition
abdominal
soudaine
pain,
des maux de tête graves ou
sudden
persistants qui
onset
s'aggravent
of
ou une vision
headaches
trouble et des contusions.
or blurred
Les
vision
décisions relatives au
or
type de deuxième
bruises.
dose qui sera offerte aux personnes ayant reçu
As
le vaccin
for the
d'AstraZeneca
second dose
seront
of
déterminées
vaccine
sur la base des dernières
for
preuves
those
et
who've already been
recherches.
vaccinated
Le
with
CCNI
AstraZeneca, more
examinera les
research
données
will
probantes à
be
mesure qu'elles
conducted.
se
NACI
présenteront pour
will
fournir des
continue
conseils
to
au programme de
review
santé publique
latest
sur la
evidence and
possibilité de
research
compléter
as
la série de vaccins avec
received
d'autres produits vaccinaux.
in order to complete
Pour
vaccination
l'instant,
with
vous
other
n'avez pas
products.
besoin d'une deuxième dose
For the
jusqu'à
time
16
being,
semaines suivant
a
votre
second dose is
première
not
dose.
needed until
Cette
up to
décision fait
16 weeks
partie de
after the
l'approche de
first dose.
surveillance et
This
d'intervention de
is
l'innocuité
part
des vaccins qui
of
est
the
établie depuis longtemps au Canada et
community's
utilisée pour
protocol
surveiller tous les
for
vaccins, y
vaccination.
compris les
We also
vaccins
have a
COVID-19.
monitoring system
Nous
in Canada
répondrons à ce signal de
which allows
sécurité
us to
au
monitor all
moyen des
vaccination,
renseignements
and this
à notre
includes COVID
disposition
vaccines.
à l'heure actuelle
We are
et nous
looking
examinerons les
into
nouveaux
the
renseignements
data we're receiving,
afin
and we will
d'éclairer
look
tout
into new
changement à
information in the
notre
days
position
ahead.
au cours des
We
jours
will
à
keep you
venir.
informed of any
Les médecins
changes
hygiénistes en
in
chef
our
sont
recommendations in the
harmonisés
days to
et
come.
travaillent en
The
étroite
Chief Medical
collaboration
Officers of Health are
afin
closely
d'examiner
aligned
les
and are
dernières données
working
probantes
together
relatives
to
à
review the latest
l'innocuité et à
information on
l'efficacité des
safety and
vaccins contre la
effectiveness of
COVID-19
vaccines
et de
against
prendre des mesures
COVID-19.
à cet
The
égard.
Chief Medical
Nous
Officers of Health
continuerons de
continue to
travailler
take
en
action as
collaboration
necessary.
afin
We will
d'adapter
continue to work
nos
together
approches au fur
in
et à
order to
mesure que la
tweak
science et
our
les
approach and
situations évoluent
recommendations as the
et de
science
fournir des directives claires et fondées sur des données probantes afin de préserver la santé et la sécurité de tout le monde au Canada.
Merci.
Merci. We'll now move to questions. We don't have a lot of time, so if possible, please keep your questions and answers short. Opérateur, à vous la parole.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. You may cancel your question at any time by pressing star 2. Vous pouvez à tout moment annuler votre question en appuyant sur les touches étoile et 2. And the first question, la première question est de Mélanie Marquis de la presse. Please go ahead. La parole est à vous.
First question, Mélanie Marquis, La Presse.
D'abord, vous n'avez pas beaucoup de temps, mais ça fait 26 minutes qu'on vous écoute, alors on apprécierait avoir le plus de questions possible.
Remaining, but we want to get in as many questions as we can. My first question is for Dr. Quash. Why are you describing this as a precautionary measure? Why didn't you simply recommend pausing use of AstraZeneca vaccine for all age groups?
Je vous dirais que cette mesure de précaution-là est prise en mettant en relation les bénéfices versus les risques. Et ce qu'on a vu jusqu'à maintenant, c'est que ces VIPIT-là étaient survenus principalement chez les gens de moins de 55 ans, sachant par ailleurs que le risque de COVID-19 est beaucoup plus grand chez les personnes plus âgées et que le vaccin d'AstraZeneca a démontré une efficacité dans la vraie vie à prévenir les complications et les hospitalisations de près de 80%. Je pense qu'il fallait quand même garder ça en tête et permettre à la vaccination des groupes de 55 ans et plus de se poursuivre.
We want to continue vaccinating those over 55.
Question suivie.
Oui, je ne sais pas, c'est peut-être pour Dr. Berthiaume.
This question is probably for Dr. Berthiaume.
Les problèmes, en fait, les effets secondaires qui ont été observés.
It's about side effects which have been reported.
Chez les gens de 55 ans et moins,
you said that these side effects were mostly reported in under 55s and in women. Why are these cases more common in women? Also, in the under 55 age group, is there a more specific age group that is at higher risk of thrombocytopenia?
Merci pour la question. Donc, non, on n'a pas d'informations. Comme ça a été mentionné, le fait qu'il y ait plus de femmes pourrait représenter possiblement le fait qu'il y a eu de plus de femmes exposées dans les groupes d'âge plus jeunes parce que, comme vous le savez, les campagnes de vaccination ont été principalement axées sur les personnes âgées et le personnel de santé.
Because, as we know, most vaccination campaigns in various places and countries have been for prioritizing seniors and also healthcare workers. And many women are healthcare workers. That's one hypothesis. At this point, we don't have any data on specific age groups that might be more at risk.
Thank you. Next question.
La prochaine question, the next question is from Mia Rabson from the Canadian Press. Please go ahead, la parole est à vous.
Hi, good afternoon. I'm just curious, if we have this concern for under 55s and we're asking for this study to take place, why are we not changing the actual authorization pending that review? Why are we just making this recommendation?
So I'll take that. It's Supriya Sharma. So just to say that in terms of the data that we've seen so far in Health Canada, we still don't have enough information to say, first of all, that the risks outweigh the benefits in overall or in any specific age group, nor is there enough data to say that one group, be it females or males or a specific age group, is more at risk. I think the recommendations, and I can turn that over to NACI representatives, are really reflecting the risk of having COVID in those younger age groups. So we're looking at a rare risk of this potential adverse event, so this severe clotting event with low platelet counts, compared to what your likelihood of having COVID, catching COVID and actually having an outcome that's also very severe, including hospitalization or death. So just to be clear on the Health Canada side, in terms of that data, there really hasn't been enough data to show that we should make a change to the way that the vaccine is used or further changes to the labeling. And that's in line with all of the other international regulators that are sort of counterparts to Health Canada, including those in Europe and the UK where they have seen cases. And again, just to restate that we have not seen any cases of this severe clotting event and low platelets in Canada. But I'll turn it over to colleagues on the recommendations.
Thanks, Dr. Sharma. I'm fine to take that one. At NACI, we are looking at this from a population-based perspective as opposed to a regulatory perspective, and looked at not only the risk of this rare outcome, but as Dr. Sharma indicated, also looked at the risk of COVID in this particular age, as well as the other vaccines that are currently available in Canada to prevent COVID. So when we took all of that into account, we made the precautionary took the precautionary measure to recommend pausing in this particular age group while further investigations are conducted.
And it's maybe, Dr. Njoo, just to round out, obviously the Council of the Chief Medical Officers of Health looked very carefully. We had a meeting yesterday evening to look at the impending NACI recommendation. And after a lot of discussion, there was a strong consensus. You can see with the statement that was put forward today with respect to what the individual provinces and territories are looking at in terms of adjusting their vaccination programs. I'm just going to check if a colleague of mine, the Chief Medical Officer of Health of the Yukon Territory, Dr. Brendan Hanley, may be online.
Unfortunately, not.
Oh, he's okay. Okay, no worries. Thank you.
Okay. So, Mia, follow up?
Yes, thank you. So my second question is about vaccine hesitancy. This vaccine has been through the ringer in many ways so far. Initially, we were told not to give it to people over 65, then it was fine for them. Now we're saying not under 55. I'm just wondering what you can say to Canadians who are looking at this vaccine, including maybe even the Premier of Ontario, and are saying, I'm going to wait for another vaccine. This one's just not worth it.
Okay, I don't know who takes this. I was supposed to take only French questions, but it's fine. I'll take it in English too. I think you're right. I mean, this vaccine has had all the ups and downs. It looks like a roller coaster. The problem is because data are evolving, we are also evolving our recommendations. And so when you look back at what is known now about the vaccine, so clots we're investigating, it seems to be the risk seems to be higher in the younger population, so we're pausing it there. However, in terms of the overall effectiveness in preventing complications and death, and in particular for those 80 years and older and the frailer ones, as shown in the UK study, we see that it actually is working pretty well to prevent that. So if you look at this overall, it's a vaccine that prevents complications and death, that in the elderly population, so over 55, but in particular 70 and over in terms of effectiveness that has been well studied, works well and doesn't seem to have the risk of clots that we see in the younger populations. Again, what we're doing is trying to contrast the risks and benefits. And so if you have that vaccine, and versus having to wait for 2 months while COVID is ramping and you're at risk of catching it and having complications from it, I think that taking the vaccine is the best option at this point in time. Thank you.
It's Dr. Njoo. Maybe I can give the perspective. Obviously, I can't speak totally for the provinces and territories, but we're very mindful, and we're obviously looking at sort of the real world experience in this. Dr. Quastran has explained that there's been millions of doses, 20 million doses plus administered around the world, and certainly it's been shown overall to be safe and effective. Having said that, there is the possibility of this rare event that unfortunately should occur, that there are potentially serious consequences. So taking all that into account, I think we're taking a prudent approach in the provinces and territories. because there is a suite of options in Canada in terms of other vaccines, and so I think having AstraZeneca among those options, I think certainly the evidence to date still shows that it's safe and effective for those over 55 years of age, and definitely because of the risk of COVID-19 itself. Obviously with respect to severe illness, hospitalization, and deaths, it's something to be considered as we are all working towards, as they say, trying to vaccinate as many Canadians as rapidly as possible. Thank you.
Merci. On peut passer à la prochaine question. S'il vous plaît, précisez à qui s'adresse votre question.
Next question.
Thank you. The next question, la prochaine question est de Tonda McCharles from the Toronto Star. Please go ahead. La parole est à vous.
Hi, thanks. I may have missed this off the top, so just first a quick clarification. I assume that everything you're talking about in terms of AstraZeneca applies to its version called Covishield produced in India. And I just also want to clarify, the 40% fatality rate, you said in those cases with where people have had experienced clotting events. I'd like just those two clarifications. My question, though, is can you explain this pretty big range? I've heard everything today from 1 in 100,000 doses to 1 in 1 million is the sort of range of incidence. Can someone walk us through really what is the risk there?
I can start off. So yes, in terms of your first question, it applies to both Covishield and the AstraZeneca vaccine. In terms of the second question about VIPIT and the case fatality, it is among those individuals with this syndrome that has been the observed case fatality to date. So among all of the people with that syndrome, 40% have died. In terms of your last question about the risk, this sort of evolution of risk is not unexpected when a safety signal is identified. So initially there is something identified as it gets described, then other surveillance systems are aware of it and more events are brought to light. And so that is why initially there was a relatively rare 1 per million. As the time has progressed, we've seen more cases that have been identified in Europe, and the rate is has been identified as 1 per 100,000 in Germany. Where the true rate is, we just don't know at this point in time, but we are continuing to follow that, the data as it emerges, both at NACI and as the regulators have indicated they're following it, as are the CMOHs across the country.
Okay, thank you. And maybe, I'm not sure who can clarify this for me, but I am puzzled how you are going to continue to follow the data and assess its effectiveness if you're pausing its use in Canada. And I assume that European authorities who are seeing the same kind of data will all pause its use. So if nobody's going to be using it in those age groups, how will you know whether or not you can lift this temporary suspension, recommend its reuse? How will you know how to recommend for people who've already received a first dose, whether they should receive a second dose of AstraZeneca, or whether they can mix and match with another vaccine, since nobody's actually trialed that either? Maybe you could explain some of that to me.
I'm happy to start and then maybe pass it over to Dr. Sharma. In terms of the mix and the mixed schedules, there's ongoing work, particularly in the UK, studying mixed schedules. And so that data will be available and we will be able to present recommendations once we see that data. Not every country has paused the use of AstraZeneca in people under 55 years of age. So there will be ongoing emerging data that we will be able to assess, and Canada will be able to benefit from that. Dr. Sharma, would you like to add anything?
Yeah, so just to say, I mean, you know, if you look at from the regulatory perspective, as I said, none of the regulators have stopped the use of the AstraZeneca vaccine in a specific age group. And if you look internationally, including Europe, we do have France, who has limited the use to ages 55 years of age and older. Sweden, that's limited the use to ages 65 years of old and older. And Norway, Denmark, and Finland that have paused the use of AstraZeneca. All the other countries in Europe and the UK, as well as the other countries that it's being used in, including India with the Serum Institute of India version, continue to use the vaccine. In Canada, obviously, we have a smaller population. So even on the basis of our population, you know, we're likely to get more evidence of any rare adverse event from international experience more than we would be in Canada. Plus, with AstraZeneca, in a lot of cases, it was still being used in the older population first as a priority group. So we didn't have a lot of experience with AstraZeneca in that younger age group planned anyway in the next short while. So it's really a pause of a limited use of that vaccine when we have alternatives in Canada. So it would be, even if we hadn't paused, or the recommendations from NACI wouldn't be to pause, we would still be relying, I think, on a lot of that international data to complete our assessments. And as has been mentioned, with respect to mixed schedules, there is a trial that's ongoing in the United Kingdom. We're expecting to get some results from that in potentially as early as June or July, but we're still some months away from getting that data.
Next question.
Thank you. Merci. La prochaine question. The next question is from Raymond Filion de TVA. Please go ahead. La parole est à vous.
Next question. Raymond
Oui, bonjour. Deux questions rapides. Combien de doses ont été administrées jusqu'à présent du vaccin AstraZeneca au Canada? Est-ce qu'on est toujours à 300 000? Et combien de temps, selon vous, ça risque de prendre pour faire les évaluations des risques dont vous nous parlez aujourd'hui?
C'est Dr. Njoo. Je vais répondre à votre première question. Oui, vous avez raison. C'est environ 300 000, peut-être 307 000 doses déjà administrées au Canada d'AstraZeneca, produits AstraZeneca.
Maybe 307,000.
Et c'est le Dr. Berthiaume pour la question de la durée de l'évaluation. Écoutez, on continue à recevoir des renseignements, on évalue les cas, on est en discussion avec nos homologues internationaux, particulièrement européens. Il y a une réunion la semaine prochaine du Comité européen de pharmacovigilance à laquelle on va participer. Donc, il n'y a pas de, je ne peux pas vous donner un temps précis, mais on surveille de façon active et on est en discussion quotidienne avec nos partenaires internationaux pour continuer à colliger de l'information et avoir définir une approche plus claire par rapport à ce problème-là qui est ce problème potentiel. On a aussi aujourd'hui, comme ça a été annoncé par Santé Canada, demandé à la compagnie de faire une analyse stratifiée des cas par âge et par sexe, puis on va avoir ça lorsque la compagnie va compléter. C'est sûr que quand on investigue des cas post-commercialisation, il faut aller chercher les données, il faut aller dans les dossiers, tout ça. Donc, il y a quand même un certain temps que ça peut prendre, mais dès que ça va être disponible, ces données-là vont être analysées, puis les actions nécessaires vont être prises.
En suivi, Dr. Berthiaume, est-ce que votre confiance est ébranlée ou un peu ébranlée envers ce vaccin?
Have you lost trust in the vaccine?
C'est-à-dire que quand un produit est commercialisé et donné à des millions de personnes, il y a toujours la possibilité de voir émerger des effets indésirables, rares. Je pense que c'est ce qu'on observe ici. Je pense que comme il y a beaucoup de vigilance partout à travers le monde, ça a été documenté, ça a été identifié de façon précoce, des actions ont été prises, les étiquetages des produits ont été modifiés. On continue à suivre le problème. Donc, ça peut arriver quand on a un nouveau vaccin ou un nouveau produit de santé introduit qu'on découvre des effets désagratoires, on va mieux les caractériser. Mais quand on met ça en perspective avec les bénéfices du produit et les risques de la COVID-19, ça reste quand même avantageux de considérer ce vaccin-là. Puis la recommandation actuellement qui a été faite par le Comité canadien national d'immunisation, c'est de regarder ça un peu en fonction de ce qui est disponible au Canada. Nous, comme agence réglementaire, on regarde l'information qu'on a, les risques, les bénéfices, puis ensuite, les autorités de santé publique peuvent décider comment ils vont optimiser les différents outils qui sont à disposition pour les différents groupes d'âge qui veulent vacciner.
Merci. Prochaine question.
Next question.
Thank you. The next question. La prochaine question est de Mackenzie Gray from CTV News. Please go ahead. La parole est à vous.
Hi there. My first question is for Dr. Sharma. I understood from your remarks earlier, Dr. Sharma, that Health Canada still maintains that AstraZeneca is safe and effective for all ages because that's what's on the label. How do people watching this square the circle that NACI says the vaccine should only be used for people who are 55 and up, yet Health Canada still maintains that the vaccine is safe and effective for everybody?
Right. Well, I can understand how that can be confusing on the surface, but what I would say is that, when we have vaccines or any medications that are being used, and especially in something that's been given to millions of people, we're going to see these rare events come up. And it's really important that we have a system in place to detect them and to make sure that we have a way to assess them. What I would say is that from a Health Canada perspective, when we're looking at the data and we're looking at these very rare events, we're going to continue to examine them. We are taking them seriously because they can have some very severe outcomes, but it's something that you can diagnose, it's something you can treat, and you can follow. When we're looking at the incidence of those rare events compared to how that vaccine could be used against, and again, we compare it to no vaccine at all, there really is still a use for the vaccine, and that it is effective in terms of preventing hospitalizations and deaths. When NACI makes recommendations, or when the they're looking at that in the context of other vaccines that might be available and their overall risk of COVID-19 in specific populations. So I think the overall message that I would say is that I think we're all on the same page, that this is something that's very rare, that we need to continue to follow it. And, if there is a concern that potentially for some people that another vaccine might be a better option, or the risk-benefit balance potentially isn't necessarily the same, it's reasonable to pause for a period of time while this continues to be evaluated. And I think that's really the main point, is that what's changed from last week to this week? Well, some time has passed. We have some reports of increased cases. We're still looking at them. And the question is, for the Canadian population, while we conduct that review, and so, I think, again, I fully understand this can be confusing, and especially with this vaccine that's had a lot of, confusion surrounding it. But what I would say is, again, precautionary approach, and we'll move forward as we get more information. But this is really the system working to look at these very rare events, to assess them, and with the provinces and territories to make those decisions about what vaccine would be best for which group at what time.
We've seen that variants of concern spread across the country, that many younger Canadians are ending up in the ICU at a much higher rate than what we had seen before with seemingly the original variant that went around. I guess this question is best for Dr. Njoo. Are you telling us that that you have a better outcome if you don't get an AstraZeneca vaccine and take your chances with COVID? Because that, to me, seems like the best information that's being put forward today.
Well, thank you very much for the question, and it's one where we're obviously we're looking at the scientific evidence. Overall, I would say, if you're looking at the variants, I think we've said it at previous press conferences, it is a race in some sense between, quote, the variants and the vaccines. And the other point I'd probably want to underscore is that it's not the vaccines alone that are going to get us out of this. Certainly at the present time, with the variants increasing and spreading throughout the country, it's important to, as you say, double down on the public health measures, the individual practices. Dr. Tam, myself, and all of the chief medical officers of health have been saying that repeatedly. So that's number one. With respect to the vaccines, overall, yes, all of the approved vaccines in Canada are safe and effective, and certainly are important to roll out in terms of protecting Canadians against COVID-19. At this point, it's certainly for individuals over the age of 55, if we're looking at the AstraZeneca vaccine, because the risks of severe disease, hospitalization, and death are quite obvious, and certainly we've learned from experience. The recommendation is yes, the AstraZeneca vaccine should still be offered, but because of this rare event, but it's something that we're taking seriously, and as many others have said as well at this press conference, we need to take a pause and take a look and examine and look at the evolving nature of what's happening in Europe in terms of new data, new evidence, lots of meetings, lots of people working behind the scenes to look at what is actually happening, let's say, with specific younger age groups. And so because of that, because we have a suite of vaccines in Canada, I think overall in terms of vaccine rollout in Canada, I think we're well positioned for the provinces and territories to continue with their vaccination programs, make adjustments in terms of how to use the AstraZeneca vaccine. But I would say, again, it's not about the vaccines alone. It's all about the layered sort of approach, including public health measures. Thank you.
Thank you. Next question.
Thank you. Merci. The next question. La prochaine question est de Christian Noël de Radio-Canada. Please go ahead. La parole est à vous.
Next question. Christian Noël, Radio-Canada.
Bonjour. Je comprends très bien la façon dont vous rationalisez tout ça. D'un côté, si on a en bas de 55 ans, on risque plus de mourir d'une thrombose que du virus. Donc, on évite de prendre le vaccin. En haut de 55 ans, c'est le contraire. En gros, je comprends la façon rationnelle que vous l'expliquez aux gens.
I understand how you're explaining this, but Canadians tuning in today, those who are over 55, they're going to be wondering, why should I take this vaccine then? What do you have to say to them? Do you understand why they might feel anxious?
Dr. Quash.
Dr. Quash.
Dr. Quash, malheureusement, a dû se débrancher.
Unfortunately, Dr. Quash is no longer on the meeting.
Pour le comité consultatif de l'immunisation, mais peut-être que du côté de Santé Canada, Dr. Berthiaume pourrait commenter.
Dr. Berthiaume from Health Canada could answer your question. Sure, so allow me to ask my question once again. Question, do you understand why people are anxious about this vaccine?
Oui, c'est Dr. Berthiaume ici. C'est malheureux que le Dr. Quash ait quitté pour expliquer dans le fond la position du Comité canadien national d'immunisation. C'est sûr que les gens, je pense à juste titre, peuvent se poser des questions. C'est pour ça qu'on essaie d'être transparent puis de communiquer l'information au fur et à mesure qu'elle nous parvient puis qu'elle est analysée. Mais à ce moment-ci, pour répondre spécifiquement à votre question, la COVID représente quand même des risques importants. Il y a presque 1000 Canadiens qui sont décédés de la COVID au Canada, il ne faudrait pas l'oublier. Donc, il y a aussi un risque à ne pas être vacciné. Je pense que la recommandation, comme ça a été bien expliqué, n'est pas nécessairement de dire qu'en bas de 55 ans, il y a plus de risques avec le vaccin qu'avec la COVID. Je pense que la recommandation, c'est de dire qu'il y a d'autres vaccins qui ne présentent pas cet effet indésirable rare-là chez ce groupe d'âge-là qu'on peut utiliser au Canada. Donc, on recommande de ne pas l'utiliser celui-là pour ce groupe d'âge-là.
We're recommending pausing the administration of the AstraZeneca vaccine in order to go with the other available vaccines. But for Canadians 55 and older, our guidance has not changed. AstraZeneca remains a safe and effective means of vaccination, similar to the other vaccines available. Dr. Njoo, would you like to add anything? Dr. Njoo speaking.
de la population générale. Ce que je peux vous dire, c'est tous les médecins hygiénistes en chef des provinces et territoires prennent l'enjeu de confiance dans les vaccins très au sérieux et c'est toujours plusieurs moyens peut-être pour renforcer aussi, peut-être augmenter la confiance pour la population générale. Avec les points de presse tous les jours, je pense que les médecins hygiénistes en chef, c'est important pour informer leur propre population avec les bénéfices et qu'est-ce qui se passe sur le terrain avec l'épidémiologie et tout ça. Donc, ça, c'est un moyen. C'est aussi une question de travailler avec les fournisseurs de soins de santé, des spécialistes et les médecins de famille pour leur fournir avec les bons renseignements, l'information crédible pour qu'ils puissent être à l'aise et plus confortables, à l'aise pour avoir des bonnes discussions avec leurs patients, parce que ce n'est pas nous autres ici aujourd'hui, c'est vraiment sur le terrain avec les fournisseurs de soins de santé pour avoir des bonnes discussions avec leurs patients, pour que les patients puissent prendre des bonnes décisions afin de se faire vacciner.
And maybe briefly in English on this from NACI, maybe Matthew or either Matthew or Dr. Deeks.
I did not understand the question. My apologies. So I think I'll have to go to Matthew.
Yeah. So as I understood the question, it was with respect to older adults and how they would maintain confidence in the vaccine program. And I would refer to the statement that was published today on behalf of NACI in outlining that, as reported by the EMA, the European Medicines Agency, the majority of the events that have been observed in Europe had been under age 55. So it's certainly something that the regulators are continuing to monitor. NACI will continue to monitor the evidence as well and update recommendations as needed, as always. But at this time, given the risks of severe disease and severe outcomes for COVID-19 in those older age groups, and the very low risk of this event, which is very rare to begin with, and then in those above 55 is rarer yet again, that the committee would still say on balance that the program is recommended, as I think Dr. Posh mentioned that in one of her earlier responses. Thanks. Shelley, I don't know if you wanted to add any more to that.
No, I think that has been covered. It really is looking at everything in its entirety. So both the rare event as well as the disease and the probability of having severe disease by age, which increases. And so it's all about the balance of the risks and the potential risks and of both the disease as well as the adverse event.
Yeah, it's Dr. Njoo. Maybe I can add, again, a perspective, I guess, on behalf of the Chief Medical Officers of Health. Obviously, I can't speak for them individually, but as I said, we had a good meeting yesterday. I think one of the important aspects, and maybe we haven't mentioned it to date, that the Chief Medical Officers of Health agree is very important, is to be open and transparent in terms of their communication with obviously the residents in their own provinces and territories. And it is tough, in terms of trying to explain this rare event and the fact that the risk is low, but it is something that needs further evaluation, and certainly we're looking to the experts, NACI and others, to evaluate. Obviously, the regulator as well, Health Canada, to look at the evidence and maybe give further guidance and direction. But in the meantime, they felt it was prudent to put sort of a pause in terms of the use of AstraZeneca for those under the age of 55. Having said that, though, I think that with their I think daily press conferences. I think the chief medical officers of health, as a credible source of information, I think are well positioned to maintain that trust with the residents in their jurisdictions in terms of giving a daily updates, good information, and so on. And as I mentioned, in addition to the chief medical officers of health, certainly we also are working very closely, all of us, with key, I think, healthcare provider organizations and the healthcare providers themselves to provide them with the credible information, up-to-date information, so that they can be informed and empowered to have good discussions with their patients, because at the end of the day, it ends up being an individual interaction between a patient, or let's say in this case, an individual who is looking to consider the vaccination, and the healthcare provider that will ultimately administer the vaccination, to have a good informed discussion, so that at the end of the day, we're all hopeful in terms of vaccine confidence, that in terms of risk and benefits, the individual person who is maybe having some questions will understand what's in play, as they say, and make an informed decision based on the risk and benefits as explained by the healthcare provider. Thank you.
Thank you. We're running out of time, so question suivie, and after that we may have time for one more.
I believe the participant has disconnected, so we might go to the next question.
Okay, so dernière question, last question, operator, over to you.
Perfect. The last question, la dernière question est de Alison Martel from Reuters. Please go ahead. Your line is open.
Thank you. Dr. Sharma, are you aware of any similar requirements for new risk-benefit analyses from other regulators?
So, I mean, in terms of the mechanism that we're using, which is called terms and conditions, it's something that's specific to our authorization through the interim order. So I don't know if anybody's using exactly the same requirement, because the systems are a little bit different. But certainly in Europe and in the United Kingdom, regulators are doing the same thing as we are in Health Canada, in that we are working with the company to do that type of assessment. Even today, we had our Health Canada representatives at a meeting of scientific experts. There's a subcommittee of the European Medicines Agency's group that monitors vaccines and medicines, and that group, the larger group, will also meet next week. So there is a lot of activity that's going on, and as we said, different regulators are asking for different pieces of information. One of the advantages of asking for the information ourselves is that we do get not only the summary sort of data that we get when we're in these other meetings, but really the detailed case report, so we can go through that ourselves. The other part of what we're doing is that we're asking AstraZeneca to also look into whether or not other more intensive monitoring should potentially be put into place to look for these types of events, these types of rare events. So that's what we are doing. But like I said, other regulators are doing similar analyses and using the tools at their disposal based on their regulatory systems.
Thank you. Follow-up?
You refer to these events as very rare. Would you consider the 1 in 25,000 vaccinations prevalence that I believe was reported in Norway to be very rare? And I recognize there may be some reason for caution around that specific estimate.
Yeah, I mean, in terms of the definition that we use, it's sort of an international definition when we're talking about adverse events that are reports. In general, we use 1 in 1,000 to describe an event that is rare, and 1 in 10,000 that would describe an event as very rare. So those are sort of the general definitions. But just to say, and I think it sort of alludes to one of the questions earlier in the press conference about why are we seeing these disparate numbers, it really depends on what you're counting. So for example, we have case reports that are coming in. Some of them are involving this rare type of clot, but it doesn't include the low platelet count. So that may not necessarily meet the sort of the definition of the type of events that we're looking at. Some, we get reports, but they're not necessarily, once you assess them, the causal link between the vaccine and the adverse events may not necessarily be there. And then the last part is it depends on the population that you're looking at. So one population of vaccinated people in one country might be different than another. So that's why we have to look at all of that type of information. And then again, when we're talking about very rare events, a difference of one reported case can actually make a big swing in that sort of that ratio that we quote. So there's still a lot of uncertainties there. That's why we're still working with our international counterparts, our scientists and scientific experts, not only within Health Canada, but of course other Canadian experts. And we have some of the most world-renowned experts in clotting in the world that are here in Canada as well. So those numbers will evolve, but it really is important to look at all of the data and then take a look at it in the context of what that means for Canadians as well.
Thank you, and thanks everyone. This is the end of our technical briefing for today. Je vous remercie d'avoir été des nôtres aujourd'hui.
Thank you for tuning in.
C'est la fin de cette séance d'information. Bonne journée.
Have a nice day.
Thank you, merci. The conference has now ended. La conférence est maintenant terminée. Please disconnect your lines at this time. Veuillez s'il vous plaît raccrocher votre ligne. Thank you for